Okay, thank you. We'll recommence on to agenda item number 6, which is actually we've touched on it quite a lot in the last item around the issue of mental health and how this is sort of tackled and recognised within West Yorkshire Police in terms of safeguarding vulnerable people. And we have seen some successes in the work we've done with some of our mental health partners within the health service. However, we know this is an ongoing issue and more will need to be done. Of course, we have the West Yorkshire Criminal Justice and Mental Health Forum that we set up in this office in 2015, and that's currently chaired by yourself, Jane, but it does include obviously West Yorkshire Police, the Transport Police and other emergency services, including Public Health England and NHS England, and the forum is, I think, really useful in addressing some of the key things we've had to deal with, in particular the changes to the Section 136 of the Mental Health Act around detention of people within custody areas, and we do receive regular updates about that. There are other key issues, but clearly that will probably be covered in the update, so I'll now ask for the update. Thanks.
So you quite rightly made the link to the previous report around drugs and alcohol dependency. Mental health then, clearly there's the 10-year plan setting out the vision from the NHS in respect of improving mental health services. We've seen the change in terms of legislation around Section 136 Mental Health Act, which you alluded to, and not coming into custody but going to health-based places of safety, which, although we don't necessarily get the volume in custody now, that has pushed the problem elsewhere and does have some implications for us around waiting times for ambulances, going to the emergency departments first, but also lengthy handover periods as well, with officers looking after patients until such time that they can be handed into the care of the health service. We'll touch on the evaluation of the mental health nurse working in the police stations. I mentioned around the definition of mental health, but also the high volume service users as well, which again, we do need to look at some multi-agency problem solving solutions to that. So, Catherine.
Okay, so clearly a big area of focus for us, not least because it contributes to a huge amount of our demand, whether that is specifically in terms of mental health issues or, as we've mentioned before, in terms of drugs and alcohol. Mental health is an underlying issue in relation to other things that make people more likely to be offenders, victims, etc. And Russ has just mentioned there about the 10-year plan set out by NHS England, and I think there's some big opportunities in that for us if we work in partnership. That plan outlines how mental health services will become more integrated, and of course in West Yorkshire we already work with health partners as an integrated care system, so in some respects some of those building blocks are already there, but that will focus on better services for children and those transitioning into adulthood, which again has very clear links to a lot of our missing episodes. And I think they are a group of people who, when they reach 16, 17 or 18 in a day, very often slip off people's radars when actually their circumstances are no different than they were a week before. So I think there's a big opportunity there, not just in terms of mental health but missing. There'll be an expansion of crisis care, including the 24/7 helpline, which again we're really fortunate to have a lot of those building blocks in place here in West Yorkshire. I think really positively there's a promise of an improved continuity of services for those entering or leaving prison, which, again, very often people will leave prison, won't have had all of their mental health and drugs and addiction issues solved whilst they're in prison, and therefore quite quickly start to relapse into the same kind of behaviour again. More trauma-informed services for children, and better support for children leaving care, which I just mentioned in terms of transition. So some really good stuff there in the plan, and I think, like I've said, positive steps for us to build on what's already a fairly positive picture, I think, across West Yorkshire in terms of some of the things we've got in place already. Section 136 is a good story, I think, and we've worked, as you say, really hard with partners in the mental health and criminal justice meeting to really concentrate on the specifics around this. So we detain on average 100 people a month who are found to be mentally ill, and none of them, since the new acts come into force, have been brought into police custody in recent months, which I think is a massive improvement on where we were.
And just remind us when that date was, Catherine. Is it over a year ago?
Was it? No. Was it? I want to say December
2017. Yeah. Yeah.
But I might be wrong on that because it's delayed a little bit, isn't it?
Yeah.
But we clearly have still got work to do, and we are doing work locally and strategically with colleagues in Yorkshire Ambulance, in A&E and Mental Health Trust departments around that handover, not just with Section 136 patients, but also in terms of people going missing from certain places. And the ambulance's response to that. The mental health app we are pushing and starting to use much more, and we've just, as a result of the data that's been collected, started to have meetings with some of the chief execs at the Mental Health Trust to utilise that data as opposed to just anecdotal stories to really help us collectively understand what some of those snag points are that don't help policing mental health trusts, and more importantly the person who's at the end of it who actually needs treatment. We touched upon the mental health nurses that work in our police stations, and we've secured some funding from N8 to look at an evaluation tool around that, which in terms of evidence base will help us continue to have that business case in terms of funding moving forwards. That work is due to commence this month, and that's being done with Sheffield University. As Russ touched upon, there's a slight change to the definition in terms of mental health, which broadens it somewhat. And I think what we are working on now is making, and I suppose this links back to your other point around drugs and alcohol, is making sure that we make then the best use of the data to try to understand the issue, not just the demand, but then how we respond to those emerging trends across some big strategic demand locations, but also in neighbourhoods as well. At some point in 2019, there's a plan for the NPCC lead for all forces to take part in a 24-hour snapshot of mental health data, which again I think will be really good in terms of a communication to members of the public in terms of just what the demand is and the various types of demand that we as a police service deal with in terms of mental health. I think it's a good conversation to continue with.
And do you know when that is likely to be and who the lead is?
No, it says, well, I know that the lead is CC Collins, because I have regular contact with Mark Collins about mental health.
So he's...
David Powis,
David Powis, right. Yeah.
Is it? I know he's one of the Welsh in North Wales, but I don't know when the 24-hour snapshot's going to be. I guess we'll get some.
Good to obviously linking through the APCC as well.
Yeah, we'll come out as an NPCC letter like it normally does around those kind of things.
Yeah. It'd be helpful for the SLR work.
Spending review, yeah. Yeah, if it could be done, well, that'd have to be done before the end of next month. So.
And then I already touched actually in the last session on high volume service users. All districts now have the liaison and diversion services, and Bradford and Wakefield districts have got appointed police officers as their mental health coordinators, and where we have that, you do tend to have a better relationship with partners that gets driven more at a very tactical level, because they are picking up on a day-to-day basis some of those issues where, you know, we have very specific issues of particular points that we can work towards to reduce some of the demand in terms of the mental health institutions that we work with. I think that's probably it in terms of highlights, because as I say, quite a lot of the mental health stuff was picked up with the drugs and alcohol paper.
Okay, yeah, thank you. So what work is being done to support the rollout of the successful first response system implemented in Bradford for the rest of the force area?
Yeah, as you know, first response, is a service provided by mental health services in Bradford, so it's not a policing service. And although this is Bradford specific, all mental health trust and commission services now sit as one integrated care system across West Yorkshire, so the good practice that's developed in that area is shared across the trust. So I think it's not within our gift to tell the mental health trusts how they should commission their services and deliver them, but I think you mentioned before about the Criminal Justice and Mental Health Board, and it may be worth asking First Response to come and present at that board with a view to then, you know, I can then bring the Bradford experience from the policing point of view, but then we can perhaps get an agreement there as a wider partnership board.
It is, because going back to the changes on the section 136, I remember when yourself, Catherine, and was it Esther, came and presented at the board, and it was a really good, tight, coordinated piece of work with our mental health partners. And certainly in the report, talked about the police officer coordinators in place in Bradford and Wakefield, and clearly the same principle with this. If it's demonstrated that the real benefits of having those in place, then why wouldn't we do it in all the districts if the benefits far outweigh the sort of the investment clear that needs to be made in those
and
also.
Clearly First Response can see a benefit in doing that. It's not just a police benefit, and we need them to come and talk to their colleagues about exactly that once we put our kind of side of the story over. So I think that would be a really positive.
Yeah, well let's do that then. Yeah. So, in understanding the and therefore addressing the causes of criminality and antisocial behaviour, what's the force doing to better equip officers and staff to consider a trauma-informed approach and the impact of adverse childhood experiences?
We've had quite a lot of training actually around this area, trauma-informed approach, and also looking at ACEs, which is adverse childhood experiences. So for a long time now we've been really pushing our officers to very clearly think about the voice of the child when involved with domestic abuse, for example, and explaining to the officers exactly why that's important, because when children witness, and that's a very clear adverse childhood experience, that can then lead to that kind of behaviour or problems in later life, which clearly we want to try and nip in the bud as soon as we can. So lots of work across the workforce in terms of domestic abuse in particular, but then with our neighbourhood policing teams, some enhanced work around recognition of ACEs more generally and what can be done to help children and young people access further support in many of the early help hubs that we've got in different guises now across the local authorities. We've also had a national expert on this area of the business called Zoe Lodrick. She's a psychologist who's been and delivered quite a lot of a presentation. She's done 4 in February of this year, again to help officers understand how the minds of young children process traumatic information and what that then might exhibit in terms of behaviour. And clearly that's not just for police officers but for school teachers and other people who come into regular contact with young people. as we mentioned before, in terms of the long-term plan, the 10-year plan for mental health, accessing therapeutic help for people who've experienced adverse childhood experiences is a key part of that plan, which again, whilst it's not for us to deliver, should have a big knock-on impact to us in terms of early intervention. And we also have Operation Encompass, which means that when children are subject or exposed to, I should say, domestic abuse within a household, we, through our MASH teams, process that information quickly back to schools so that teachers are confidentially aware of what might be going on in a young person's life and can start looking out for the signs. So yeah, lots of information, lots of training to officers over the last 18 months, which will continue because this is something that's becoming much more to the fore of conversations now, I think, in terms of early intervention. And all of our PCSOs and new recruits now get that as standard as part of when they join the force.
Is that what you just mentioned there around the schools link? Is that in place across all schools in West Yorkshire? It's
across all primary schools in West Yorkshire, and it's called slightly different things in different places, but mostly Encompass. It's the same. It does the same thing. It's called slightly different things. Some places take a bit longer to get those referrals out to teachers than others. Sometimes it's within 24 hours. Other times it can take a few more days. But that's a partnership-led intervention by children's services into their schools.
Okay. And then it's just to ask how officers and partners are working together to ensure criminal and antisocial and detrimental health outcomes of substance misuse, mental health are addressed at the earliest opportunity through a preventative and family-based approach.
Yeah, okay, so we've touched upon, as I said, the high-intensity user network, and part of that, whilst it's in partnership, clearly focuses on the individual, but will also, if they are individuals who are part of a household, pick up on the family, and through the early intervention hubs, what impact that's having on the younger people that live in that household. We've spoken about the Bradford and Wakefield officers who have the direct links as missing mental health coordinators, my apologies, who again, have those links in with partners to give not just the individual but the wider family support. And again, liaison and diversion services are also developing, whilst they're quite new, they're holding a mental health partnership away day in June to make sure that they share good practices in terms of what they're learning in the custody suites about not just the individual but that wider family network. I think, if I'm honest, I think that's an area that in terms of sheer numbers is very difficult to resource.
Yeah.
Because if you try to impact upon every individual who lived in a household with somebody who was suffering from some sort of addiction or mental health illness, clearly we wouldn't have the resources to go around, and so there's got to be some sort of prioritisation in how that's dealt with.
Yeah. No, I understand that, and so just going back to the trauma sort of the therapeutic counselling service, I'm certainly looking to how we can provide more of that in the development of the sexual assault referral service that will be hopefully in place within the next 12 months at the new SARC centre. Yeah. Anything else from you, Jane?
Just to ask about the work by Sheffield University. So they've just commenced, but I wonder if you've got an idea of when we might have an evaluation report from them?
I don't. Have you got any idea, Justine? No. No, sorry, I don't know the exact dates, but yeah, fine, I'll find out and come back to you.
Thank you. Thanks for the update on the approach to tackling mental health.